Well, welcome everyone. Thanks so much for joining. It's great to see you all. We're doing a little bit of a new spin on our Voices in Leadership seminar today. I want to thank Aisha for coming up with this awesome idea. It's the best idea ever. We have so many really outstanding leaders among our MD MPH student classes, people who have done amazing things. And we have the opportunity today to hear from three representatives of our current graduating class, Nicole, Nika, and Paige. And they're going to tell you a little bit about some of their experiences and open the door up for questions. But hopefully, I think this will again provide some insight into ways or pathways that you all can take to pursue the things that you're passionate about and create new ways to have an impact while you're a student, and then moving forward into your residency and into your career as well. We try to in each of these Voices in Leadership sessions, and there are a couple more that we're going to have later on this semester that we'll talk about at the end. We really, ask, hope that we're asking of ourselves, all right, how is it that I'm going to ultimately be able to take what I'm getting out of my MD MPH combined curriculum and the experiences that I'm gathering and be able to apply this, to tackle new problems in a way that is meaningful and impactful, and in a way that, gets me excited to get up and, go to school or go to work every day. And I think you're going to hear from your peers today, some of their experiences in that regard. So without further ado, I'll ask Aisha to be the master of the program today, and we'll hear from Nicole, Nika, and Paige. Thanks, everyone.
Thank you. And thank you everyone for joining us. As Dr. Springate said, that we've created this series with mainly for two reasons. One, you are all doing incredible and impactful work in the community and in regards to health policy and research, and that work deserves to be recognized and it deserves to be shared with the rest of our MD and PhD team and family. And the other reason is because to answer the question that we frequently get is, how can I continue to engage with public health as I move into my clinical years? We're hoping that this series kind of shows you ways that our students are continuing to work with public health, even as they're moving within their clinical realms. And also, I think it kind of also helps to show that there is no one path and no one method to involving public health and to utilizing public health with medicine. And so we have really three great examples of different ways for you to incorporate public health in medicine. So we have our three lovely students here today to kind of talk with you about their experiences and the work that they've done. Nicole is one of our fourth-year students focused in behavioral and community health sciences. She's a member of AOA and the Gold Humanism Honor Societies. She's done research projects within internal medicine, family medicine, and psychiatry. As an Albert Schweitzer Fellow, she works with increasing access to community resources among the homeless population. She's also a member of the Rural Scholars Track. So if any of you have any questions about pursuing that track, this is a good opportunity for you to ask her about her experiences in that. Nika, another one of our four-year students, he's focused within health policy and systems management. His research is focused on emergency contraception availability in Louisiana, measuring quality of life in young cancer patients, telemedicine outcomes in pediatric urology, and he's pursued a lot of health policy and community work that he'll talk with you about today, both as an Albert Schweitzer Fellow and also with 504 Health Net and Louisiana Cancer and Prevention Programs. And hopefully you all had the opportunity to view Paige's presentation that was previously recorded. We weren't sure if she would be able to join us today, but we're thankful that the ED has been able to spare her for a little bit. But a lot of her work has focused on women's health outreach, working with the Women's Health Shelter, and focus on running a flu shot clinic and looking at postpartum and maternal mortality and things like that. So we're so happy to have them all here today, and hopefully you will take the time and take the opportunity to ask them any questions that you have about the work that they've done. And with that, I'll kick it off to Nicole.
Hi, everyone. Let's just get started. So about me, I feel like I need to explain these pictures. So when Nika and I made this PowerPoint, we decided to go with the vibe of just low-key, personal. So at any point in time, just feel free to like ask any questions. We're very informal people. So this is from when I studied abroad in the United Kingdom. And I thought I could jump over this puddle, and I obviously did not successfully do that. And this is like a before picture when I'm put together. So yeah, my name's Nicole. I'm from Thibodeau. I went to LSU for my undergrad years, and I also studied English, fun fact. I decided to pursue behavioral and community health sciences. And for my future, I'll be going into peds, and we find out in like less than a week. So I really wanted to kick it off with, first and foremost, how can we look at each and every single patient that we see in a public health lens? So again, I want this to kind of be like a discussion. So I'll just read through the case scenarios one by one, and you can come off mute or write in the chat, whatever you want, and just say what we kind of need to be thinking about. So the first one, these are all real cases. It was a 7-year-old female, no past medical history. She presented with knee redness. She was brought in by her mother, and she showed up an hour late to her appointment. So the questions I kind of have for you with this is, first and foremost, should we still see this patient? Should we still see them an hour late? And why do you think she might have been an hour late to her appointment?
Could be unreliable transportation.
Yeah, that's great.
I have 2 kids. One of them are 3. I'm sorry, Ben. I have 3, and one of them is 7. And it could, if it was like, let's say like a septic knee, it would probably take an hour for me to convince Theo to get in the car. You know what I mean? So I'd be thinking like, what if it's something serious? We have to see this child, and also like, you know, especially with a pediatric patient, like even if it isn't a transportation problem, you know, they may have a lot of fear coming to the doctor, and then to turn them away after having that like emotional experience, I think would really have a negative impact on their trust and feelings about accessing care.
I totally agree with you. Anyone else?
Oh, I was gonna say the parent may have been held up at work or unable to get to the appointment on time for some reason like that.
Excellent. So in the interest of time, I'll just give you the spoiler to it. So I was inspired by this mom. Basically, her story is that she didn't have a car of her own, and she was relying upon her friend to drive her to the appointment. She was appropriately worried. We were also worried. We thought it might be a septic joint. And she still decided to bring her daughter. So we saw the patient. We went ahead and saw the patient. Next scenario. It's a 16-year-old girl with 3 prior chlamydia infections of this past year. It was all within the same year. She presents with vaginal discharge and lower abdominal pain. And this is in the inpatient setting, just to give you context.
She might not have, oh, sorry.
No.
No, I was gonna say she might not have access to, education, like sexual education, or she might, just be in a situation where, she's afraid to, because her parents might be super religious or something like that. And so she's afraid to talk to anyone about those types of scenarios.
I think that's some great thoughts. Anyone else?
I think there's also, to piggyback on that, I think, the education piece, when that's missing, you can't prevent it, but you also don't know what you're risking, right? So, the long-term effects of like PID, if you don't even understand like sexually transmitted infections, how can you protect your interests when you're 30, when you're 25, when you're 40? So like, I think like understanding the impact of something like that throughout the lifetime is really important, and maybe something that we don't always do well. She's still in peds, she's 16.
And another piece of detail to kind of add to what you're saying is that she had been with the same sexual partner this whole year. So that adds like another lens to this about what we needed to be telling her and what knowledge she might have of her partner, sexual activity in general. Anyone else? Okay, for the last case, something that's near and dear to my heart. My mom was a special ed teacher. So it's a 12-year-old male, and he has a past medical history of autism, and he's presenting for a well child check. So this is a leading question, something that you might not realize prior to going into clinical years, but you could substitute this diagnosis for anything. It could be COPD, it could be heart failure. Basically, we're not treating patients in isolation, and they need like these systems of care, right? So going back to our case, this child with autism, we need to be connected with his school environment, right? Does he have an educational plan in place? Is he connected with physical therapy, occupational therapy, all these other things that he needs to achieve his best health outcomes? So I promise there are like answers to these, but you guys came up with them. So yeah, that first one is barriers to care and truly understanding why the patient presented an hour late. I really liked what both of you guys said. Well, I think there's three of you guys. First of all, the child might be unruly, they might not have transportation. And at the end of the day, this was an acute complaint that we need to deal with. And we need to understand what might be going on else in their life. For the second situation, importance of sex ed. We live in a state that doesn't quite enforce that across the board. Does she even have the availability for barrier methods or access to them? And then finally, access to healthcare. Another piece of her story is that she had inconsistent access to healthcare. So something I did as a medical student on my PEDS inpatient rotation is that I really advocated for her to get some of her missing vaccines. It's part of all of the discharge paperwork, like are they up to date on vaccines? But I went that extra step. Like I care about the public health implications. I care about the fact that she clearly has some barriers to care. She clearly doesn't have the access part that we need. So let's get this done right here and right now. We had them on the formulary, so she went ahead and she got a vaccine. So that's an example of something you can do as a medical student. And then for the last one, it's what I kind of already said. So seeing how individual diagnoses can lead to like these greater systems of care. All right. So then going into what are some of the specifics you can do. Both Nika and I did the Albert Schweitzer Fellowship, so I'll just give you a brief overview for what this is. Basically, it's a program that is aimed at graduate and professional school students in the New Orleans area, and it's really to impact our very underserved community. And you come up with this 200-hour intervention where you're going to directly affect the community. You're going to be among the community helping them. And the other piece to it, along with this great community work, is that it creates this peer network. You and your fellow, I was about to say your fellow fellows, but your other fellows are really this network for each other, and you're meant to support each other. So my project, as Aisha mentioned, I created a resource guide that had 10 local New Orleans services, ranging from healthcare, mental health services, dental care, healthcare, shelters that had their phone number, their address, and their website. It was like one page that was laminated, and it was made to be about the size of a dollar bill so that could fit in their pocket. So I did research along with this. I would hand it out every weekend during my third year. Every weekend I could, that clinical rotations didn't interfere with it. And I was really inspired by this project, and I felt like it gave me a lot of motivation for my clinical work, and it gave me a lot of context because I really could see how I could envision a future where I was doing public health along with, my clinical duties. So I partnered with Ozanam In, which is also where we do the student-run community clinics. This is our cohort. I'm in the front right here, and Nika's in the back. just further reinforcing that these are our peers and we really were like learning from each other through monthly meetings and retreats. Another thing I did, so between L1 and L2, you do your practice experience. And I don't really see this as like an extra thing we do. I think this is something that most medical students are pursuing in one way or another. They're pursuing usually like AHAC, which is the role experience, or some kind of research in general, because this is like one of the few like free times that you have to yourself to cultivate these experiences. So I really took that as a chance. And I felt like I had so much leverage by having public health backing me up. Like I had a proposal and like the backing of the school to say, I need to do this project and these are the things I need to get from it. So I went up to Baton Rouge, just being familiar with that area and being familiar with Pennington. And I should have known from the beginning that I was going to go into pediatrics, but I'll get to that later. I worked at this pediatric obesity lab where we put on the American Diabetes Association summer camp and did research along with it, because there are a lot of these summer camps that happen for children to benefit their health, but we really wanted to do research to see, are these changes sustainable, or is it just a week-long event? So we promoted healthy lifestyles through nutrition courses, physical activity, and we also assessed their psychosocial metrics. And this is the part that was like particularly hard-hitting for me. So the children at the beginning of the week, like on Monday, they said things on the survey that included, I believe my peers don't want to play with me. I believe that I'm not as strong as them. I believe I can't run as fast as them. And I don't think I have very many friends. Even by the end of like the 5 days of the camp, like by that Friday, by that Saturday, they were saying to a lesser extent, like those really sad things. Like they were saying that essentially they had formed a peer network. And the camp really was aimed at anyone at risk for type 2 diabetes or obesity. So it didn't necessarily mean that you had those diagnoses already. So I think that was the key here. We weren't isolating the children based on a diagnosis and like grouping them just that way. It really was people from all ranges. So the children really could see that, oh, I can make friends and I have this great like support network. Another thing I want to touch on right here, I didn't make a slide for it, but just about how you can go about research in your third year. So being in Rural Scholars, I was kind of in a unique situation. I knew I was going to be spending that whole year in Lafayette. So in advance, I thought I was going into internal medicine, but I contacted the internal medicine faculty in Lafayette. And I said, I'm really interested in this. Do you have any current projects that I can work on? And they very immediately responded and set up all these meetings for me. And one of the projects I later got involved in actually has like a lot of public health ramifications. It's about lung cancer screening. So if you look at the current recommendations per USPSTF, that's like the big go-to for current screening recommendations. It's that you have to be 55 and you have to have a certain amount of pack years of smoking. So we assessed whether that was appropriately capturing like the patient population at risk, because you at that point you order a CT to evaluate for lung cancer. So that was very interesting to go through that research study and basically like 3 years of a database of all the lung cancer diagnoses. So that's another idea. If you have a specialty interest, not that you need to know, I didn't know, you could contact those people in advance, or again, if you have that interest. So this is another thing I want to touch on. So I'm going into pediatrics, and I felt like they pushed public health in all these different terms on all the residency websites. And in their discussions of their program, in interviews. So if we look at the top right, I know this is busy. There's this urban health and advocacy track. So basically, this is public health. It's about how can we talk about those barriers to care? How can we talk about a lack of access, specifically for urban communities? At the very bottom in the center, leadership and advocacy, under-resourced communities, and health equity. Like, what more public health can you get? And then top left, community engagement and advocacy, scholarly concentration. It's promote child health and reduce child health disparities. So these are all specific tracks and pathways in residency that you get further education, and there's also usually a very strong community component. Are there some questions coming through the chat? It's kind of hard to monitor that up here. Oh,
Yes. Oh, sorry. Do you see that, Nicole?
yeah. Oh, that's so cool. Okay. That's wonderful. I'm glad that they're expanding it. I'd like to say my research project did that, but it probably didn't. That's wonderful. Oh, and then I just added in this slide. So less public health centered, but these are just some different tips that I got from various different people before going into clinical years. And I just wanted to tell you guys this right now. Clinical years, I felt like I was waking up. They're so much better than the first and second year, because you're truly doing like what you got into medical school for. Like, you want to see patients, you want to help them, you want to talk to them. The second piece of advice that I got was to treat every rotation like you were choosing that specialty, you wanted to go into it. And I really feel like it's the best framework for how to take it and how to like treat each day, because you don't know. I did surgery first because I was like, I'm definitely not going to like it, and I ended up loving it and kind of giving myself a quarter life crisis. So you have to just treat every day like, oh, I could be doing this, and for today I am, so let's enjoy it. And then my final point is that fourth year really is the promised land. Like, you hear for so many years that like, oh, just wait until you get into fourth year. And I promise it's true. I'm sure Nika and Paige can talk more to that. So that's all I have.
All right, cool. Thanks, Nicole. So hi, everyone. Nice to virtually meet a lot of you. My name's Nika. I am from Lafayette, Louisiana. I also went to LSU and got a degree in biology. My concentration is HBSM, and my future career, I am applying for pathology residencies. So I guess a little bit of background on me. When I first came to medical school, I had absolutely no idea what I wanted to do with my life. I will say I was like pretty 99, 100% confident that I was going to pick a specialty with direct patient care. So pathology has come way out of left field. And if anyone is interested in pathology and wants to talk about it, I'm more than happy to talk about it. Also, if anyone gets into their clinical years and they're like, you know, this is not as great as I thought it was going to be, also come and talk to me because we can chat about that too. I did pursue a master's in public health because I kind of thought, again, like I wasn't sure what I wanted to do. So if I got the additional degree, it would give me sort of like a different perspective to healthcare, and it would open a lot of doors in the future. And so it's kind of the mindset I went into it, and I was like, let's see what would happen. My photo here is from my surgery rotation. This was taken right after I passed out in a surgery. So for those of you on your clinical rotations, if you've done something that you feel is horrifyingly embarrassing, don't worry, someone has done something worse. And for those of you in your preclinical years, you have a lot of exciting times to come, so just buckle up. You can go to the next slide, Nicole. Thank you. So as an HPSM person, I started the Master's in Public Health, and we did that summer of those classes the first year. And after that, I kind of realized that I'm very much a person who likes to do like hands-on learning. And as much as I enjoyed the coursework, I wanted something a little bit more tangible. I wanted something a little bit more real world. So I reached out to Miss Amber Brown, and she connected me with the policy director at the Louisiana Primary Care Association. And I just kind of randomly shot them an email, and I was like, hey, how do you feel about free labor? I am offering myself to do whatever you need as like a health policy kind of person. And she was really great, and got me involved. And through that, I was able to, so I did my practice experience with them. But over the roughly year that I worked with them, I helped coordinate an application for the CDC REACH program. We didn't get the grant, but it was cool to have to put the whole grant together. I also helped to organize the LPCA's Louisiana Legislative Day. And then I worked and helped to create a partnership with the Office of Public Health while I was there. And sorry, I realized I didn't explain what the LPCA is. So the Louisiana Primary Care Association is a nonprofit organization that sort of advocates and supports federally qualified health centers around the state. So all of the work, I would say, was, some of it was very policy focused, and that's just because I was working for the policy director, of course. But most of it was primary care focused, and then primary care focused in underserved areas and a lot of lower income or communities of color. So that was kind of, I would say, my introduction to the real world of health policy. Finished my time with the LPCA and then moved over to a local organization, 504 HealthNet, which is kind of pretty similar to LPCA, but is just focused in New Orleans as opposed to the whole state of Louisiana. And then similarly to Nicole, I applied to do my Albert Schweitzer Fellowship there. We both did our Albert Schweitzer in our third year. So, you can do it at any point if you're interested in your med school career. I don't know, I guess you can't really do it first, but second year, third year, you can even do it. There was someone in our cohort who was a Tulane MD MPH student. She was in her fourth year. So it is possible at any point. Anyways, so my project was to create a New Orleans Primary Care Community Advisory Council. And essentially the idea was to understand what some of the barriers to access to care were in this federally qualified health center safety net, primary care system in New Orleans. And so we convened this council that met once a month, and it was 8 individuals who either were currently or previously had access to care through the safety net system. And we just met every month and kind of talked about different barriers to care. Kind of the broad goal from my sort of health policy perspective was trying to identify what sort of state or local policies could be implemented to begin breaking down some of those barriers. 504 HealthNet also had an interest in trying to develop some, programmatic interventions that would also begin to address reducing those barriers in order to get people into that safety net primary care health. Did my Schweitzer Fellowship, really enjoyed it. I did a couple of other, projects. If you ever do this sort of random internships with these organizations, you get kind of pulled in a lot of really fun different directions. And, you kind of, don't say yes to everything, right? You have to keep your sanity, but if something seems interesting or challenging or exciting to you, I definitely encourage you to kind of explore it some more. And then a couple months ago, I started a new health policy internship with Louisiana Public Health Institute. And I have a few roles there, but the big one right now is that I'm helping to generate the organization's internal policy agenda. And so it's just kind of meeting with a bunch of people within the organization and then trying to distill the work that they're doing into specific policy efforts so that when they come up in legislative session at the federal level, at the state level, even at the local level, everyone in the organization is on the same page. And then if the organization has sort of a policy wish list, for example, this is what it would be. And so I think it's a really it's been a really interesting progression starting from my time at the LPCA to now, because I think now I'm getting to apply a lot of the stuff that I've learned from that time. So helping to plan the legislative day, you understand, you learn a lot about what does it mean to advocate for specific policies? What does it mean to, speak with your legislators and organize that for an organization, and how to kind of take your talking points and build them into kind of really quick communications that helps you get your point across in a really quick way. And so and then a lot of the sort of on the ground work that I did with the Albert Schweitzer Fellowship, I think is also really helping inform, okay, so all of these policy people are talking about, these issues and these problems that the state is facing up here, but then actually speaking to real life people and like what their barriers and problems accessing care are, gives me a really sort of unique perspective that I can blend. So it's been really fun. I think that's pretty much this slide. So another thing I did some adolescent health research. And so these are the projects that I have worked on this side. I'm not going to kind of belabor these points, but basically it was one was a secret shopper study to identify adolescent access to contraception. And some of the things that I got to do in that, data analysis, kind of recalling from that biostats class we all took that first summer, learning how to communicate research findings, how to do analysis of policies at the state and federal level regarding emergency contraception dispensation. And then another project was developing a survey to assess pediatricians' attitudes in the state of Louisiana towards care provision for adolescent parents. And there are a couple of other things there. The point that I kind of wanted to make on this slide was that, so you see both, so one of them started in September 2018. I can't see the bottom of the screen, but whatever that start date is down there. To the left side, you can see when, so obviously I learned a lot in this time, but these projects were sort of completed in December 2020 and February of 2021. So it did take some time. So for those of you younger, first or second years, if there is a research interest that you have, my recommendation is get out there and look for it and start doing it now. Sometimes it takes a little bit of time for all of your ducks to line up so that you can kind of get it all done. And then of course, like you're going to be very busy, right? And then the people that you work with are also going to be very busy. And so there is some coordination there that has to happen. If there's any piece of advice I can give for this is be persistent, right? So like if you sent an email and you haven't gotten a response, wait a couple weeks, send another really polite email, wait a couple weeks, send another really polite email. I promise you there are very few people that you're bothering. Most of them are just super, super, super busy and do really want to help. So be persistent and advocate for yourself. You kind of have to. Yeah, I think that's that slide. So naturally, I did adolescent medicine research. I did a lot of primary care work. And so very naturally, I decided to pursue a career in pathology. And there are a lot of reasons why that is the case. And again, I'm not going to sort of belabor that. If anyone's interested, we can chat another time about that. I will be honest with you today, I don't really have any plans on how I want to combine health policy and pathology. Obviously, it came up a lot in interviews, and I was able to like scramble an answer together. The best answer that I can give to y'all right now is that I think one of the most amazing things about pathology, and I think you could say this about radiology as well, but as these diagnostic specialties in this day and age, there's almost no patient that can walk into a hospital and not be touched by a pathologist or radiologist, right? It's going to be indirect, right? So like the radiologist's not going to walk in and be like, hey, got your chest x-ray right here. But the things that they do and the services that they provide and the knowledge that they have impacts such a broad spectrum of patients and populations. And so when you're talking about systems level work and systems level thinking and the changes that you're making at the systems level and how they're trickling down to impact patients, impact public health, impact population health, I think the pathology labs are one of the best places to do it because you're going to be impacting so many people. But again, to get off my little pathology box, from even though I did a lot of this adolescent medicine work, even though I did a lot of this primary care health policy stuff, I gained a lot of really great skills, policy advocacy, writing grants, data analysis, how to communicate scientific findings that, whatever I end up doing in my future with pathology, I'll be able to use, and I'll be able to draw upon. And although, I think talking about poor access to emergency contraception for adolescents in Louisiana is interesting. I don't know how many pathologists are going to be like really fired up about it, but I think, the data analysis skills and the manuscript writing skills and all of those things will sort of come in handy in the future. And as I was just putting this together, I was kind of reflecting on these last 4 years. And I came up with a few pieces of advice. The first thing is be open to trying new things that might even scare you. So what you might have gained from the beginning of this presentation, I had no interest in pathology. If you told me a year ago I would be pursuing pathology, I would have laughed at you. And here I am today. And when I, decided to kind of make the jump to pathology, it was really scary, but I am 100% sure that it is what I should have done from the beginning, and I'm glad I discovered it somewhere along the way. Many of the other opportunities that I've had have been things that I would have never really guessed I would have gotten into. So be open to trying new things. All of you have worked really, really hard to get here. You've passed tests, you've taken classes, you've gotten degrees, you've done amazing things, and you owe it to yourself to take advantage of every opportunity that comes your way that might interest you. So do it. The second one is to network. Again, 4 years ago, I would have not told you that networking was a skill or an ability. I thought it was just like chatting with people, sending a few emails and calling it a day. I have learned that it is probably one of the best skills that you can learn. If not at this stage, at a later stage, or hopefully you've already learned it. But network with people, meet with people. One of the really great advantages of the MD MPH program is not only is your network your medical school colleagues, but it's also your public health colleagues. And so you have so many people to reach out to, you have so many people to help guide you and kind of just give you advice on where you should go. So really take advantage of that. And then the last thing is don't stress about the process, just enjoy it. I think the big difference between fourth year and first year is that I'm still pretty lost, but I just feel a lot more confident in being lost, right? So I think the big difference is I know I want to do pathology. I know I want to integrate public health. How? Don't really know. But you know what? I'm going to figure it out. And I think the big difference is that I have the skills now that I feel like I can do that. I feel like I can go out there and, explore pathology and talk to different people and then leverage the skills that I've had to do something interesting, fun, and exciting for the rest of my life, I guess. And I think that about wraps it up for me. So Paige, if you're still on, I'm going to throw it to you.
I just want to say, Nika, there's so many ways that you're going to find that you're going to integrate pathology and health policy. I mean, I can think about just as off the top of my head, just think about all of the different COVID tests that have come out in the last year under various emergency use authorizations, and how many of them should be used and which ones should be used in what settings, which should be used for symptomatic people, for asymptomatic people, for kids, for adults, for, with what level of accuracy, with what frequency in congregate settings, in prisons, in other settings, in schools. There are so many policy questions there, and right now there's like billions of dollars flowing towards all of that. This is just one example, right? Just off the top of my head, because we do this work, but you are going to be inundated with opportunities. It's going to be really cool to watch.
Yeah, I'm excited. I'm really excited. Thank you.
Okay. So let me know if y'all can't hear me because I know I have my mask on, but I'm in the hospital. Sorry. Well, I feel really inspired after those two people speaking. I don't know about y'all. I don't have my slides with me because I'm on my phone, but I know Aisha sent them out ahead of time. Mostly what I talked about was really kind of turning something that you're passionate about into research. And that's how kind of I chose to spend my third year. You're really busy in the clinical arena and you don't necessarily have a lot of time to start something brand new from scratch. You certainly can, but it's definitely easier if you start from something that you already kind of have a solid footwork in. So I think a lot of people, especially in the MD program, you are involved in things first and second year really heavily because you're just studying and you have all this time to do volunteer work or leadership work. And then you kind of get to third year and naturally those roles kind of fall off because they're kind of set as L2 roles. So if you were a president in a club or something like that. But my advice is to kind of not let those roles define kind of who you are in the third and fourth year. So I was the co-director for the New Orleans Women's Shelter during my second year. And it was something I had volunteered with since first year. So I was really passionate about the work that was being done there. and I didn't really want to pass it off when I finished second year. So I had a fellow like partner co-director, and we decided to stay on and kind of just make a new role for ourselves into third and fourth year. We changed the names to a bunch of things like co-presidents, co-advisors, whatever you need to like call it. There's no reason you can't stay involved with something. And so what we kind of did was we decided we would take kind of an advisor role, and then also turn some of the work that we did when we were co-directors into research projects. So I never really thought that your community outreach could become research until someone told me, like, you're doing really great things. Maybe you should share that with other people and find a way to do that uniformly. And so I actually came up with 2 research posters based on that work. So one that was focused on interprofessionalism, because when I came into the role as co-director, NOWS is supposed to be an IPSA organization, but it really wasn't very interprofessional. It was run by pretty much medical students. It was pretty much staffed by medical students. And so our goal was to kind of figure out the schedules and the time commitment of all the other different schools of medicine or schools at LSU to kind of integrate them better, and create active partnerships between people. It sounds very like team uppy, but that's kind of what we did with NOWS. And then we hosted a flu shot clinic for the first time at NOWS, which is something that the student-run homeless clinics do all the time. They administer vaccines. And so we were kind of like, why can't we do that? And so we piloted that. Since the flu shot's pretty easy, everybody needs it, and everybody can get it for the most part every year. So I ended up presenting both of those things as research, and both at our local LSU School of Public Health Research Day, and then nationally as well at the APHA conference. Both of those were virtual presentations because of COVID. So I will say that might continue in the coming years. So research might also not be something that's so like expensive to go and travel and present. So just something to kind of keep in mind, that research is really doable in the third year. And also my advice on research is you get more done when you do it on your own. I've definitely been on projects with like 3 or 4 people and nothing has happened in 3 years. So don't be afraid to kind of just start something on your own if you have an interest in a mentor. And then kind of moving into fourth year. I think fourth year for me has been a time of reflection more than I haven't like done a ton in terms of I've been able to listen to a lot more public health lectures. I've been able to attend all those things that sometimes in your first and second year, you're like, I don't have time for one more thing. And so I think I've been a lot more inspired to kind of look towards the future in my fourth year. And then in terms of kind of residency and beyond, I'm going into OBGYN, which there's a lot of public health and definitely a lot of advocacy involved in. It's, I think, what has kind of drawn me to the field. And I think in my interviews and where I interviewed at different programs, I definitely ended up preferring programs that had a bit more of a public health kind of focus. I think I had the best conversations with programs when people brought up my MPH and actually asked like why I chose to pursue it and what I was going to do with it. My top program is a program that had a program director who has an MD MPH. And so just kind of like finding those connections along the interview trail was really fun and kind of helped me, because I asked them like, what are you doing with your MPH? Because I think as much as we stand here at the end thinking we know what we're doing with our MPH, we still don't. We have 3, 4, 5 daunting years ahead of us where we're going to be really busy clinically. And then we're going to kind of be in the same position again, where what are we going to do with our MPH? So don't feel like you have to figure it all out by the time you're a fourth year either, because you definitely kind of have a lot more work to go through. And I think just be open to when things come your way, because I think people say that in public health all the time, but I think things kind of literally just land in your lap, and just be open to saying yes to them.
Awesome. Thanks so much, Paige, Nika, Nicole, and Aisha. This has been really terrific to hear from you all, and we'll open the floor for questions at this point. I'll ask Aisha to manage that piece.
Sure. So if anyone has any oh, Hannah, go ahead. You can come off mute.
I had a question about turning your philanthropy into research. So I kind of find myself in a similar situation page, but like anybody who wants to answer. So I'm the chair of Tiger Cubs, and we had to basically reinvent the organization. We had like a couple of years where I think things were just really challenging, and then the year above me, like that, their coronavirus year. So like if an organization was already struggling and then that happened, like things kind of naturally kind of didn't eventuate, right? So we had to like make a new partnership and then create an entire new curriculum. And it's been incredibly rewarding, and I've enjoyed every minute of it. And I tried like to do a little bit of token, like pre-survey, post-survey type thing, like as part of the teaching model. But I don't know where to find a mentor to help me develop it into something I can share, because it is share worthy. And like, I would absolutely want to like be a part of the conversation about local health education for kids. So if you could talk about that, that'd be great.
Yeah, I'll talk, and then I'll let Nicole talk too, because I know she was involved with Tiger Cubs as well. So she can kind of probably relate or possibly mentor you in that as well. But in terms of taking something into research, don't feel like you have to have like really hard data. I mean, I think public health research is not, I think a lot of what we learn in class is you need a lot of data, you need a lot of numbers. But the topics that I presented on and were able to go on to present at national conferences even were not necessarily things that I had like tons and tons of numerical data on. A lot of it was qualitative. I wish I had done more like pre and post surveys for throughout the whole time that I was serving at NOWS, but I didn't. So I really had more of like in a year from start to finish here. So I revamped a student run organization that provided healthcare services to the homeless. I mean, that's as simple as it is, but that's kind of in itself still something that's worth sharing. So I would say that don't feel like you have to have numbers to do research. You can definitely take qualitative information and share it, make graphs, make tables, compare things, and just kind of relate it to a local and then a national level. Like what else is being done in Louisiana, and then is this being done at other medical schools, and can you share that with other medical schools, and that can kind of be like your target. And then in terms of a mentor, I kind of went to the public health side first. So I talked to Dr. Donna Williams because she was technically she was like our advisor for NOWS. So if there's a specific faculty mentor or advisor that works with Tiger Cubs, I would say try to get them involved if they want to be. And if not, try to find someone in the public health world who shares a passion of that and ask them. But I would say, like, especially for public health research, you don't need necessarily like, there's a lot you can do on your own. I don't think that you need someone kind of like, because it's not as clinical as medical research.
Yeah, I'm an epi student, so I don't have as much like behavioral, you know what I'm talking about? So I feel like a lot of times I'm like, well, is it significant? Like, whatever. And then Dr. Maupin is our advisor, and he's just like the busiest person I've ever met in my life. There's like no way I'm gonna have a meeting with him like once a week to talk about like, oh, I wrote another paragraph. Like no. So thank you.
Yeah.
Okay, cool.
I just wanted to say quickly off of that. So like, I mean, I'm an HPSM person, but I've worked with a lot of BCHS faculty. So don't let like your concentration restrict you. Everyone at the School of Health is super well, like we're like, regardless of what your like concentration is, everyone's super like open door, I feel like. So it definitely just like bust in there and be like, hey, I've got some questions.
Thank you. All right, so now we'll move on to Fatima. She has a question.
Thanks, Aisha. So I guess you guys kind of touched on it when all three of you guys spoke. But I guess my question is, for third year, do you feel like a lot of, when you're doing research or any type of public health work, do you feel like you are helped or like, to do that, or at least, what's the word I'm looking for? I don't want to say indulge, but like, do you have to do a lot of that outside of, like on your own time? Or is that something that you feel like, when you're in rotations, that's something that people are willing to work with you at the same time? Or is it, like I said, outside your own time? And because I worry about how I would be able to fit all of that when we have so much going on in third year. I wonder how, that's something, how to, handle all that or manage all of that at the same time.
That's definitely very fair. I think one of the big differences between third year and the first 2 years is that, especially second year, every 2 weeks you're taking tests. So you kind of get in this vacuum. Whereas, for instance, for your surgery clerkship, there's kind of like 12 weeks and then you take a test, or like 9 weeks. So I felt like you almost got some of your time back and you were better able to time manage and say, I'm going to study for this amount of time. I'm going to work on public health for this amount of time. For in my experience, it was my hours outside of the hospital. I wouldn't say that they delegate time for you to like work on personal things. It's kind of what you make of your time when you're at the hospital, because there is downtime when you're at the hospital. For instance, Paige in OB, when you're waiting for deliveries, it's when they happen. That might be 2 seconds from now, or that might be 7 hours from now. So it's, again, what you make of that time. You can do your old questions, you can work on an abstract or a manuscript, or do data analysis. When your time is to yourself as a medical student, no one's really policing what you're doing. So I feel like that's another great piece of advice. Like, be as productive as you can be, like while you're at the hospital, and you do have that downtime.
Gotcha, thank you.
All right, do we have any more questions? We may have time for just one or two more. No.
I have a question. Thank you all for sharing your stories. It was like super cool to hear all of it. In regards to like residency applications and stuff, did you find that like the interviewers or however that process worked, like they were really engaged in your public health work, or was it something that you had to kind of pull out and kind of like show? Because I'm like worried now with like balancing all the research and all the extracurriculars, and I can like barely keep up with like my personal life and then med school and then in addition all that other stuff. But then I tell myself like, well, I am getting like an MPH, and so that in of itself I feel like should be helpful. So I guess if you could talk about that and your experiences like with applications and stuff, that would be great.
I can talk about it a little bit since I brought it up. So your MPH, which something actually we had to kind of, I had to like remind the person who submitted our transcripts for our national, like our residency application. I kind of like went and realized and looked at what was being uploaded one day, and I was like, oh, this doesn't include our MPH transcript. It just is like our MD transcripts. So I had to like, and I don't know if that was not happening before, but so first of all, like your transcript should be uploaded as, you know, your MPH transcript, and then it will be designated somewhere on your application that you're an MPH. So even if you do no research, no extracurricular work in your public health time, it's still a designation on your application. And that alone is something that is unique. So I would say most of your residency interviews, or from my experience at least, they ask me about things that were unique about my application. They're not going to ask you about something that like everybody has. So if people going into OB all have done like this certain thing, then they're not going to ask about it. But if you have an MPH, that's kind of setting you apart from the get-go. So some people will ask you about it just because they're interested, and they're like, oh, why did you choose to do that? And how did that affect, you know, your training, and how will that, they kind of like sometimes twist it into like a, oh, what does that mean your strengths are? They love to ask about strengths and weaknesses and all that. So they might like twist it into a, what can you bring to the table kind of question. And then for me, it was kind of like scattered all throughout my extracurriculars as well. So my research and kind of outreach, community outreach projects were very public health focused as well. So it's pretty easy. I don't know that I ever brought like getting an MPH up on my own because I didn't necessarily think about that. But that is a good point, that if someone ever asked you like a strength or something that you bring to the table, you could like use that opportunity to talk about your MPH right then and there.
And one more thing, I think it's all how you frame it. I think we would have like a whole conversation on this, because we had a panel ourselves where fourth years talked to us about how they framed it in their interviews. I brought it up in my personal statement, and it came up in every single interview, because it really has shaped like what I want to do, at least what I think I want to do in my career. And I was really passionate to talk about it. Albert Schweitzer came up in every single one in one way or another. And those really were the best conversations. And at least the way the faculty would talk to me about it, it was more like networking, like Nico was talking about. They were like, this is what I'm doing in health disparities. I feel like it really connects with what you did with the homeless population in New Orleans. Like, what do you have to say about that? And it was almost just like they were just passionate about it and they just like wanted to talk to me about it. So I loved that part of the interviews.
And I'll just add something real quick. I think the nice thing too is it kind of gives you like an ace in your back pocket, right? So at the end of the interviews, everyone's like, do you have any questions? And everyone's like, you can't not have questions. You have to have a question, right? So if someone hasn't asked you about the public health thing, you can bring it up yourself. And you can be like, hey, like, can you tell me a little bit more about how your residents have integrated public health and the work they've done? And in that way, it doesn't sound like you're just like reaching for something really random. It may, like, to the interviewer, it makes sense. They're like, oh, this person's going to have a master's in public health. Obviously, you know, they care about this. And I think it's a really nice way to kind of start a conversation, or at least continue the conversation with your interviewer, rather than being like, do you like each other here? You know, like it's a much less awkward question, I found, at least. So it's a nice like leverage point to also have in the interviews.
Well, thank you so much, Nicole, Nika, Paige, Aisha, for organizing this. I want to acknowledge Dr. Culbertson. Hi, Dr. Culbertson. Thanks for joining as well. This is been a really terrific set of presentations, and I've been so impressed with everything that you all have shared. It sounds like, you know, your colleagues and peers have as well. So let's give a round of virtual applause to our presenters for today. I think I hope I'm not mistaken by saying they're probably open to you guys emailing them separately and, you know, asking them, you know, follow-up questions if you want. And best of luck to all of our class of 2021. Next week is the match. Super excited for you guys. Really looking forward to seeing everyone again soon. We do have 2 upcoming Voices in Leadership seminars. One is going to be from Dr. Ryan Pasternak, who's some of you have worked with, obviously, and he's the vice chair of pediatrics and the director of the Center for School Health and an adolescent medicine expert. He'll be talking about his experiences coming from where you are as medical students to, you know, where he is today as a physician leader in public health, and also Dr. Leron Finger, who is the Chief Quality Officer at Children's Hospital of New Orleans, and the Incident Command Chief for the COVID response at Children's Hospital, as well as the lead for the Children's Hospital, Louisiana Department of Health, Louisiana Department of Education effort to provide guidance and support to schools across Louisiana who are trying to reopen safely in the context of the COVID pandemic. He's an intensivist by training, a PICU doctor, but a really thoughtful public health leader. And so those will be coming up in April and early May. We'll be sending out those dates soon.